This is Tom Lee, editor-in-chief of NEJM Catalyst, and we're talking today with Dan Littlequist, the Chief Strategy Officer of Intermountain Health, and Jim Weinstein, Senior Vice President for Microsoft Healthcare. Intermountain and Microsoft recently formed a rural health coalition with an interesting set of partners, Gates Ventures, Epic, and West Health. Various combinations within this group have collaborated to do interesting things in the past. For example, Dan and Intermountain worked with West Health to start Civica. Now, based on that track record alone, I found myself intrigued by what this group might do. Their stated purpose is to work together, quote, to meet rural patients' needs and improve rural facilities' financial health, unquote. They are just getting started, but I asked Dan and Jim if they would talk with us about their thinking and what they might be able to do together. So Dan, let's start by having you quickly describe the challenges, which I know that you know all too well from your work at Intermountain. You have described three huge issues that are important for all healthcare organizations, but especially tough in rural settings.
Yeah, so Tom, great to be with you. Rural healthcare is facing severe challenges, including shrinking access to care, growing health disparities, and rising mortality rates. There are 60 million people in the United States, basically 1 in 5 Americans, who's at risk of losing their health care. And it's imperative that we take action. Rural hospitals are struggling with diminishing patient access, insufficient staff, unsustainable financial models. About 20% of rural Americans live in counties without hospitals, and many lack access to essential specialties like oncologists. Staffing shortages is a big challenge. Over 65% of primary care professional shortages are in rural areas, and this is expected to worsen by 2030. And this is particularly tricky. Places like Intermountain, even in our urban settings, a full 25% of our doctors and nurses are expected to retire by 2030. So that shortage is hitting urban centers, and that prices will get worse in rural areas. And then finally, many rural hospitals have very limited cash reserves, with some only having less than 20 days of cash on hand, leaving them on the brink of closure. So these challenges are substantial.
Okay, Dan, you successfully gave me and all of our listeners a panic attack. These are tough issues to be sure. But why this group of partners? What do each of them bring to the party? Jim, you want to take a crack at that?
Yeah, let me pick up, Tom, on some of Dan's comments too. The financial issues are tremendous. But, when we talk about patients, and Dan knows this as well as you, the cancer mortality rates are, 10 times in some cases that of urban areas. The heart disease rates are 3 to 4 times. The chronic respiratory conditions are 4 to 5 times. And with an aging population in our country, not just only are the challenges technically and regionally, as Dan mentioned, but these health illness rates are going to continue to rise. And the cost of this without activity that we're planning here is just going to further hinder our country's ability to care for the aging population. These partners, Microsoft, West Health, Gates Ventures, and Epic, I think are quite interesting. As you know, we had started the High Value Health Collaborative years ago in this kind of hub and spoke model with Mayo Clinic, Denver Health, Intermountain, and Dartmouth. And Intermountain's always been kind of the principal partner. It's really been the pillar of quality and cost for this country in the 30 years I've been studying this through the Dartmouth Atlas. So the ability to actually work with Dan and the Intermountain team to form a coalition around not just rural health, but urban rural health in this hub and spoke model is a fantastic opportunity for the reasons we just said. So I'm really excited to participate. It's the first chance, I think, since the High Value Health Collaborative that we've been able to think about how we can bring this country together in a sustainable model to improve health and quality for the country.
Well, I know that the tech functionality that Microsoft and Epic can bring to challenges like rural health are very important. But what are the roles of Gates Ventures and West Health? Dan, you've worked with both. What's your take?
Well, both Gates Ventures and West Health are active in looking for opportunities to address systematic market failures that hurt people. Tom, which is your great statement that you made a couple of years ago, that's what the things we should be focused on. And I've so appreciated Gates Ventures and West Health because they are focused on how do you find ways to re-platform the system on something that's more sustainable. And so this coalition really began with Gates Ventures and Microsoft say, hey, this is a problem approaching Intermountain. We, of course, I've worked very closely with West Health for some time. We brought in West Health and then later brought in Epic, all of us trying to focus on this broader problem together, but through different lenses. Intermountain really provides the expertise in implementing the hub and spoke model, which we've done for many years, supporting rural hospitals with what we call our virtual hospital, providing telemedicine, tertiary and quaternary telemedicine services remotely. That has helped stabilize rural hospitals in our areas. Microsoft, of course, leaps forward in their technology and their cloud compute and their infrastructure and cybersecurity. That's a component that needs to be figured out, as well as how do you have an extensible health record that reaches throughout the country, and that's a role that Epic can play. So there's a lot of pieces coming together here. Do we think this is a comprehensive list? By no means. In fact, the opportunity to engage more broadly with the community is one of the reasons why we published our white paper and made this announcement. This is a systemic national issue that's going to require a variety of solutions layered together.
Well, Dan, having followed your work on Civica very, very closely, I know you're going to do more than publish a white paper on the nature of the problem. So what exactly is the coalition going to do, and how are you going to do it? Dan, why don't you go first?
Yeah, so if you think about the most important thing we need to do, and Jim hit on this, is we've got to work to solve the healthcare disparities. The reason why rural health is in such crisis and the reason why those mortality rates for cancer and heart disease are so much higher is there is a tax that every rural American pays to get healthcare, and it is a time and distance tax. And it's very, very difficult to overcome that. And what we've learned at Intermountain through the use of telemedicine and specifically hospital to hospital telemedicine programs, that we can extend expertise in rural areas around the country, allowing patients to get the care they need closer to home. It's one thing to have a patient walk in, as a patient did in one of our hospitals that we support in Alaska with a stroke. It's another pretty amazing thing to have that patient receive a door-to-needle time to get the clot-busting drugs into their veins faster than any academic medical center in the country because of the expertise that is extensible from these larger health systems into these rural areas. So that's the first focus. It's how do we make sure patients can get the care locally? Now, a patient that's kept locally, Tom, they're also cared for locally, which means they get to bill for that service locally. They get to stabilize the revenue in their hospitals. Some of these hospitals, if you lose a half a person census a day, it's the difference between being in business and closing down. And so those are some of the things that we're focused on. Let's focus on clinical care first, and then that will lead to better stable financial situations and allow us to address some of the other challenges that are emerging. With that, Jim, what would you add?
Yeah, I think that a couple things we're doing on the tech side is Dan mentioned cybersecurity. Microsoft's rolled out a rural health tech initiative that really provides free cybersecurity assessments and by thoroughly qualified technology partners, and then helps rural hospitals, critical access hospitals, to implement cybersecurity. As you know, rural hospitals are a major attack site for cyber criminals, And this project just started rolling out, and we have, I think, over 500 rural hospitals seeking our help here. Further, I think to Dan's point, we're going to improve access to specialty care with technology that allows patients not to have to travel. They can keep them in their communities. They can have better referrals in their own communities, which helps their financial viability. We're going to strengthen their overall technology infrastructure because a lot can be done through the cloud today. Everybody doesn't have to buy all the products and licenses. We can help communities with need assessments. As we all know, one size does not fit all. We tend to kind of package things for the whole country. The whole country, every community is different. And we can help to create partnerships through these hub and spokes that might enable them to function better on their own. And finally, as a researcher, I would say we're going to expand research and resources to rural communities. Too often, clinical trials are not representative or generalizable to the population. And we have clinical trial matching tools today that are automated. And with an understanding and participation of rural communities, we can have better treatment developments and more resources and better drug treatment for rural communities that are representative of those populations.
Okay, so I'm starting to get it, I think. Yeah, there's an array of things that can be done, and you've got the abilities and the technologies to make a dent in those problems. Let me ask, how will you and we be able to tell in 2 years whether the coalition is actually having some impact and making a difference? Jim, you want to go first and then Dan?
Sure. Well, first, we're already having an impact because we get to talk to you, Tommy. So that's the biggest impact. We're getting lots of reach outs from major medical centers and rural communities. I gave the keynote at the AAMC for all the deans of all the medical schools in the United States, and this was one of the key topics. And almost every medical school is anxious, and they're actually starting a new coalition of medical schools to train future doctors in this kind of hub and spoke model. So it's pretty exciting to think about that. But the new models are clinical, financial, and technical. And I think this brings new methods to bear that we haven't had, new measures to use, which you're an expert in, and new data dashboards besides HCAHPS and others to really look at specialty care, to really look at how technology is adopted and also cybersecurity is improved. Most importantly, as we've all mentioned, is better patient outcomes and satisfaction in their own community. We'll be able to also think about workforce development. And when we look at actual measures of things like financial things like days cash on hand, operating cash flow margins, cash conversion cycles, i.e. the days payable outstanding, revenue growth, net profit margin, et cetera. Most of these things that are critical to run these organizations are just not possible infrastructure-wise to do effectively. And we think this model, working together, can expand nationally to help achieve this.
Dan?
Well said, Jim. I might add to that we need rural healthcare to work. And then when I say we, the country does. The demand increase on the services at Intermountain Health and other large health systems around the country are accelerating. The baby boom generation weren't expensive to treat at 65. They're going to be really expensive at 75. I think this next decade, it's going to put enormous strain on the entire healthcare system. The rural hospital networks are absolutely fundamental to making sure that we have enough capacity in the country to care for these populations. And what's happening in rural areas where these hospitals are shutting down, those patients are either dying or being transferred in to larger health systems, disrupting their families, and there's not enough space for them. So we have colleagues in the industry who are buying rundown hotels to try to house patients who are coming in from rural areas because of the capacity challenges. So we've got to find a way to extend expertise. There's no way to just grow specialists and pop them up around the country, but we can extend their knowledge into critical access hospitals using this hub and spoke clinical model. That should allow people more confidence to get the care, life-saving care that they need at their critical access hospital, supported by health systems like Intermountain and others that have the expertise that they can lend through telemedicine to these places. And that is a way to do it. At Intermountain, we've been pioneering this model for the last decade or so. We are averting about 15% of transfers from rural hospitals that we support that would ordinarily be helicoptered in to see us. They're able to stay local. That is a massive positive financial impact for those communities. And this model really is about that. How do we upskill these communities? How do we better support them clinically? That will lead to better financial stability, much better patient outcomes, and that also gives us then a broader framework to work on the policy and regulatory issues that need to undergird a program like this. So Tom, lots of work ahead of us. This problem is not going to go away. It is also not going to fix itself. It is going to require partners like Microsoft and Epic, philanthropy partners, and health systems like Intermountain and others to figure out how to do this in a mutually supportive, non-extractive way. Too much of the resources have been pulled out of these communities. And if we're going to repair this, it's got to keep the patients and the revenues as local as we can make them.
Well, I have to say, I admire the spirit of deciding that there's no problem too big to be taken on. And then I admire the wisdom of, as long as you're going to take on a big problem, let's get some friends to work with us on it. Friends like Microsoft and Epic and Gates Ventures. And I am going to be very interested in seeing what you do. And I think, as you hinted at the beginning, there are going to be lessons from what you do that have impact on non-rural settings as well. You both know the joke about how many great ideas have come out of Boston over the last 2 centuries, but very few have gotten in. I am betting that we are going to learn from the work that you're doing, and we will continue to follow along in NEJM Catalyst and get updates from the two of you on a regular basis, I hope.
Thanks, Tommy.
Thanks, Tom.
I think that the digital infrastructure for our country, especially around things like healthcare, that are some of our biggest social contracts with the country, is critically important. We don't want another COVID episode where we aren't connected and understand how we can help people in not just urban, but rural communities as well. I think these are challenges are ambitious but necessary. I think we can leverage advanced technologies like artificial intelligence, machine learning, telehealth, cloud computing, etc. But if we're going to improve access, these are the kind of tools we need. And we need comprehensive community needs assessments so we meet the needs of each community, not what we think the needs are. And we need to measure the impact and either fail fast or move forward. And we really appreciate you giving us the time to talk together today.
Well, thank you again.